Good morning, everyone. Today I'm going to tell Dushon's story, but this is not just Dushon's story. This is my story as well. I am going to read it because I still get a little emotional, and my goal is to get through this story without being emotional this morning. Um, May 1999, picking up my mail at the post office, I received a letter from the Sickle Cell Disease Association informing me to call Children's Hospital of Michigan to make an appointment. This is how Dushon's life starts. The first appointment that I went to at Children's Hospital was an educational session with Dr. Wanda Witten-Sherney. She explained everything that could happen to an individual living with sickle cell disease. It was at this time that I decided I would learn all I could and become the expert of Dushon's sickle cell disease. As Dushon grew, he became the type of child that every parent would want: polite, kind, considerate of others' feelings, and just an overall sweetheart. His only downfall was he was an only child and didn't like to share. Once he started school, he became a perfectionist. If he didn't receive an A, he would be upset with himself and cry. Also at this time, I was learning everything I could about sickle cell disease and the effects it has on the body. I was also watching my child to see if I could notice any changes in him that might be due to sickle cell. November the 8th, 2010, at about 10 a.m., something seemed to be wrong with Dushon. His room was upstairs, and I could hear him breathing downstairs. He had stayed home from school that day because he was having sickle cell pain in his knees. Now, we were used to dealing with pain at home as long as he could tolerate it, but when it began to get really bad, we would pack a bag and go to the hospital. But this time, something was different. I climbed the stairs to find my son in bed, and I knew when I looked at him, he had a stroke. His breathing was different, his eyes were open, and his mouth was twisted. He also would not respond when his name was called. I called 911 and explained that my 11-year-old son was having a stroke and to send someone immediately. I can recall the 12 minutes it took the EMS to arrive as the longest of my life. Once Dushon was admitted to ICU, we learned that he not only had a stroke, but multiple strokes, one behind the other, due to black blood vessels in his brain, all related to sickle cell disease. ICU was also where he underwent 3 brain surgeries, 2 of them being an emergency, and stayed 5 weeks. He was then sent to a regular room where he would be for another 5 weeks. Finally, we transitioned to inpatient rehab, and this is when it hit me that our lives would be forever changed. Dushon went from an independent child who didn't want my help with anything unless he asked, to a total care patient who needed me to do everything for his survival. Inpatient rehab is where I learned to take care of Dushon. It seemed that I was starting over with a newborn in an 11-year-old's body. Dushon cried from the time he woke up in the morning till he went to sleep at night with no breaks. This went on for 7 months. Then one day, it was like the scene in the movie Forrest Gump when he is in the service and it's raining for months, and then one day it just stops. Well, this is what happened. This is what happened with the crying. One day it just stopped. This is also where I faced my first challenge outside of sickle cell disease. Some of the doctors on the PM&R team decided they didn't want Dushon discharged into my care and that he would be better off in a group home. I was actually given a list of homes that had availability for him and told to go and check them out and decide where I wanted to send him. This same doctor told me that I was still young and I should not feel bad for putting him in a home because then I could still live my life. As a parent, you can imagine how I felt hearing the doctor tell me to put my child in a group home. After being discharged home by ambulance because Dushon was unable to sit upright and now considered a quadriplegic, I found my situation had not only changed with the care of Dushon's sickle cell, but also the new challenges he faced after the stroke. Because of the strokes, Dushon was placed on a blood transfusion protocol and receives blood transfusions every 2 to 3 weeks. He has diagnoses of spastic quadriplegia, hypoventilation, seizure disorder. He has to complete physical, speech, and occupational therapies. He has to have regular CAT scans and MRIs of the brain and head. He has had close to 100 surgeries and procedures. And last year, he spent 270 days in the hospital due to infections. My house now has more medical equipment than furniture. We have a Hoyer lift, hospital bed, customized power chair, manual wheelchair, bath chair, and a stander, just to name some of the equipment. From my perspective, having a child with sickle cell disease has been a journey that required me to become an expert in not only sickle cell, but also many other areas. As a parent, you sometimes have guilt because your child is born with sickle cell and you know that you are a part of the reason. You not only have to learn about sickle cell, but you have to learn to navigate the medical world. No one tells you about the additional medical appointments that are required, the medications that you have to start giving so young every day, and issues that you may have with insurance companies. You have to learn about why you have to see a hematologist, pediatrician, ophthalmologist, neurologist, neurosurgeons, physical medicine and rehab doctors, pulmonologists, and have special tests such as transcranial Dopplers, X-rays, CAT scans, ultrasounds, and possibly MRIs. No one tells you that instead of having the 1 or 2 annual appointments, that you now have to have 4 visits per year, and each one comes with a blood draw. That waiting to see doctors at these appointments could take hours and sometimes multiple trips to the doctor's offices or hospital is required. No one tells you that fever is not only a symptom of sickle cell, but with fever comes an automatic hospital admission of at least 2 days, and that's with no other issues. No one tells you as a parent that you will now have to learn about medical insurance, prior authorizations, referrals, number of approved visits, covered medications, pharmacies, specialty pharmacies, approvals, and denials. No one explains that you sometimes have to follow up with the doctor's office, insurance company, and/or pharmacy regarding treatments, procedures, and medications that your child needs. And with each follow-up, you have to explain your issue, the situation, why you're calling, what you need to happen, and what you need to do to get the results that you require. Currently, Dushon has a team of doctors that I trust and know they have his best interests in mind. Together, they have encouraged me to be an advocate for my son, ask questions when I don't understand something, and to express how I feel at all times. I have also realized how important education is in making sure that whatever treatments, medications, or procedures that Dushon may need, I have the information to make a clear and informed decision about it. One of the most important things to me is that Dushon's doctors are clear and honest with me. Although the news might not be good or something I want to hear, I can respect the honesty and we can work together as a team to figure out the next step. In closing, my favorite post that I have ever seen on Facebook and describes me perfectly is, I have slept in a hospital chair, skipped meals, cried from fear and joy. I have become an expert on my child's condition. I am a strong advocate and have had to make life-changing decisions. I am the parent of a sickle cell warrior. Thank you.
If we